Hello, Dr. Dave Marsh, Eaglescliffe Medical Practice. In this video, we're going to give you a brief overview of chronic kidney disease, or CKD. And we're going to cover three basic areas. What is it, how we classify it, and what you can do and what we can do together to help maintain it. So chronic kidney disease is a long-term condition where the kidneys don't function quite as well as they should. It's incredibly common, and we find certainly in our older population that the majority of the patients have got this condition. We need to keep a very close eye on it on an annual basis generally, because the kidneys can deteriorate to the point where they stop functioning altogether. So it can be caused by a number of diseases, common ones being high blood pressure, diabetes, high cholesterol, and also things that affect the kidney directly. So whether it's infections or damage to the kidney, such as polycystic kidney disease, and also anything that disrupts the urine supply coming out of it. So think things such as kidney stones, or say any bladder disruptions, or if you've got a prostate, any enlargement of the prostate that will affect the flow of urine coming through. So symptom wise, it can be nothing at all. It's generally something that we can just pick up accidentally. But there can be a whole host of other symptoms as well, such as feeling tired, swelling of your hands and feet, and also feeling a bit short of breath. Can also be quite vague symptoms of feeling a bit sick, and some more obvious symptoms such as seeing blood in your urine. So chronic kidney disease is split broadly into 5 different areas, 1 to 5, with 1 being completely normal kidneys and 5 being quite damaged kidneys that may require dialysis. The majority of the patients that we pick up are somewhere between the sort of the 3 and 4 range, and that we can comfortably manage within primary care. The way we pick this up is through 2 tests. 1, a blood test, which looks at how your kidneys are working, and also a urine test. So as I said, with the blood test, we're looking at what's called your renal function, and more specifically your estimated glomerular filtration rate, or eGFR for short. This gives us a rough indication of how well your kidneys are functioning. And as you can see here, the stages are broken down with actually the results of the eGFR being given. So if it's 90 or higher, that's deemed normal, and that's, we just sort of file those away. But as you sort of drop those down, you can see on the graph sort of next to me how the different stages kick in. So urine is useful because it gives us what's called an albumin creatinine ratio, or ACR for short, and it effectively shows us how much protein is in your urine that shouldn't be there. So as you can well imagine, the more protein that's in your urine, the poorer your kidney health is. So what can be done about it? So the big one is lifestyle, okay? Making sure that you've got a healthy weight, and also that if you are smoking, that certainly you stop. Certain over-the-counter medications, mainly ones that are non-steroidals, things such as ibuprofen, diclofenac gels, need to be avoided and minimized at all possible, as that may affect your kidney function even further. Within practice, we need to keep a very close eye on your blood pressure, as we know higher blood pressure can adversely affect your kidney function. We may want to start offering medications such as ACE inhibitors that will lower your blood pressure and also protect your kidneys at the same time. Likewise, gliflosins, which is a newer type of medication which is shown to be quite protective of the kidneys, and statins, that old favourite, which will help lower the cholesterol and help maintain that blood supply to the kidneys themselves. And once we've got the reading stabilized and we're happy with the diagnosis, we need to make sure that we're monitoring both the kidney function test through a blood test and also the urine test on at least a yearly basis. The majority of the times everything's normal, but what we don't want to do is miss if the kidney functions were to drop off, and that may trigger referral to a nephrologist or to the renal team, just to make sure there's nothing further that we can add. So I hope you found that useful. In this video, we've covered a brief overview of chronic kidney disease. We've talked about what yearly testing needs to be done, and also the importance of maintaining a tight blood pressure control, whether we need to start on statins, and also the key importance of maintaining your own health. As always, if you've got any further questions, I'll leave a couple of links below to some really useful resources, and also feel free to book in a routine appointment so we can discuss this through. Many thanks.